Is your vision impairment keeping you from enjoying a quality life? Well, the folks over at Newsom Eye can help. Dr. T. Hunter Newsom joins us today to discuss LASIK surgery. Good morning.
Good morning. Thanks for having me.
I'm glad to have you here. I'm glad we're talking about LASIK surgery this morning. I feel like I have a lot of family members who've done this. I've heard a lot of good things about LASIK surgery. Explain what it is and who is kind of the ideal candidate for LASIK surgery.
Well, really anybody that needs glasses or contact lenses and needs something as a prosthesis to be able to see better, they're a great candidate for LASIK.
Is it someone seeing far, near? I mean,
really it's everything. So we can deal with LASIK whether you have issues with distance vision or near vision or anything in between. LASIK now can offer better vision without glasses for all of that.
Is there a certain type of age candidate that would be best? Because I feel like I have friends that are young that were ready to get it done. And
typically, most of the studies we're doing between patients that are about 18 years old, and then it goes up into your 60s. So really, it's a wide range of people that are candidates.
How difficult is the procedure these days? Has it changed quite a bit over the last years?
It's advanced and the technology's gotten better and better and better. So we use all laser LASIK with patients, and it's typically just to numb your eye as a simple little drop. It takes maybe about 5 to 10 minutes to do the procedure. So it's not a real difficult procedure on patients. Most of our patients are up driving and kind of back to their normal activity the next day.
Oh wow, the next day.
Yeah, the next day, yep.
Do you do one at a time? Can you do both?
We typically do both eyes on the same day. So it's nice for patients so you're not doing one eye and coming back a week or two later and doing it. And they really get visual recovery back very quickly most of the time.
How long does it normally last?
Well, when we do LASIK, it's really going to change your eye permanently. So it will have an effect and will give you that improved outcome for the duration of your life. As patients age, there are other issues that come up, such as cataracts, glaucoma, macular degeneration, that LASIK is not going to prevent that from happening, and those can still cause issues. But LASIK really will change the shape of your eye forever.
Wow. Well, and I'm really glad you're here because it's funny, we were talking, you know, not all LASIK surgeries are the same. Not all surgeons are the same. What is it that is about you and your team that kind of sets you guys apart?
For us, we really treat every patient as if they were my mom or if they were my wife.
Really?
Yeah, it is. And I've done LASIK surgery or cataract surgery on almost 16 of my family members.
Oh, no way.
Yes.
My
goodness. So we really, there's not a difference of what I'm going to do for my wife or for the next patient, because we know that they might be right there on that day of surgery or one of our staff members' families. So we really want to do the best job with each patient that we see and make sure every patient's taken care of and is comfortable and give them the best amazing outcome or the best Newsom Eyes that we can. Yeah,
let's talk about this Newsom Eyes, because I kind of hear this. This came from your patient saying,
a patient, yep.
I've got Newsom Eyes now. They're better than awesome. They're Newsom.
It was. So it was a patient, our nanny that takes care of our kids. She sent her aunt in, and we did her surgery. She had this great, awesome outcome, and she was happy, or this amazing outcome. And then they asked us to sponsor. She was a swim coach as well. They asked us to sponsor this little local swim team. We said, sure, no problem. My wife does different charity stuff, so she did it. And they put together a little brochure, and on the back of it they said, watch the race through Newsom Eyes. And we're like, wow, that's amazing. You know, Newsom Eyes. And then we used to say a new vision in sight. We got rid of that, and we listened to our patients, and they came up with Newsom Eyes. Yeah,
well, I know how much you love your patients. I know how much you love your team. And talk about that too, as far as the specialized, you know, people that you have there as part of your team. That kind of, from my understanding, sets you apart as well.
It does. So we do thousands and thousands of surgeries every year, which really puts us at the top 1% of procedures being performed. So we're able to really fine-tune and hone our skills, not only surgically, but as well as making the patient feel comfortable and discussing questions and answers with them, which really I think sets us apart from most places where our goal is to treat every patient like they're your mom and give them an amazing outcome, not only visually, but just the entire experience.
I was going to say that's awesome, but that's Newsom. If someone is watching this morning and says, you know what, I've heard about LASIK, I want to find out if I'm a candidate, I'm ready to do something about it, what would you have them do?
I mean, the best thing is they can go to our website, newsomeye.com, or give us a call at 813-908-2020 and talk to some of our refractive counselors. They answer questions all the time.
And look, 3 locations here in the Bay Area, so you're everywhere. Doctor, thank you so much. We appreciate it. We look forward to having you and your team back.
Thank you very much.
All right, and again, there's the number on the website to find out more information.